Thank you everyone for attending our collaborative health and wellness presentation today titled Planning for Recovery, Proactive Measures for Post-Surgical Care. I would like to thank the staff who have taken the time to be here this afternoon. They will be sharing information about our health and rehabilitative services at Cornwall Manor. I've worked for many years with these professionals, and I can attest that they are all knowledgeable and skilled in the services and care they provide. Today's presentation is the first of what I hope will be a series of seminars to assist Cornwall Manor residents in understanding what encompasses holistic health and active aging, and how Cornwall Manor can partner with you to reach your physical, social, cognitive, emotional, and spiritual goals. Your health and wellness and overall quality of life are very important to each of us. I must preface this presentation by stating that for 13 years, I was a practicing recreation therapist. Not many people know what a recreation therapist is. Some people confused me for a physical therapist, while others referred to me as the activity lady or the bingo girl. I must admit, toward the end of my career in the health center, I began to refer to myself as the bingo lady to residents who had difficulty remembering who I was. After saying, "I'm Jocelyn, the bingo lady," many would smile, laugh, and say, "Oh yes, that's right. You better call my numbers next time." Recreation therapists work with individuals with varying abilities to create leisure equity through therapeutic adaptations. Recreation therapists assist with emotional, social, cognitive, and physical well-being by offering a variety of activities that increase function and promote quality of life. In recreation, we often use games not only to recreate and have fun, but also to assist individuals in coping, healing, and understanding their life circumstances in a simple yet profound way. James Greery said, "A metaphor is both detour and destination, a digression that gets to the point." That said, so here's my point. If you fail to properly plan, the road to surgical recovery is a game of chutes and ladders. How many of you have ever played the game Chutes and Ladders? Wow, a lot of people. Good. In 1943, Milton Bradley introduced a new board game called Chutes and Ladders, which has continued in popularity over several generations. Here is a picture of the latest version. Cute. Milton Bradley based the game Chutes and Ladders on an English game that dated back to 2nd century India called Snakes and Ladders. For those of you who are unfamiliar with this game, the objective of Chutes and Ladders is to be the first player to reach the final finish line at the top of the board game. If your game piece lands, so players take turns rolling a dice or spinning a spinner and moving their game piece forward the number of spaces shown. If your game piece lands on a space at the bottom of a ladder, you get to climb up to the space at the top of the ladder. If your game piece lands on a space at the top of a chute or slide, you must slide down to the space at the bottom of the chute. So the first player to reach the space at the top of the board wins the game. The popular phrase, "back to square one," is said to originate from this well-known game. So, like I said, the path towards surgical recovery can often resemble a game of Chutes and Ladders. Just as in the game, progress may seem steady and promising only to unexpectedly plummet due to setbacks or complications or down the chutes. Conversely, Small victories and advancements may propel the individual forward and up the ladders. That's what we hope for. Much like the unpredictability of the game, the road to recovery is filled with twists and turns and unexpected challenges. So don't roll the dice on your recovery. So again, today's presentation will instruct and empower residents on how you can take control of your rehabilitation journey through collaboration with the Cornwall Manor team. So, first, I need surgery. Let's follow this purple pawn on the hypothetical rehabilitative journey. The first step is to notify. As soon as you know that you have an upcoming surgery, please notify us. The wellness office. Call us as soon as possible. The more time we have to plan, the greater your chances of obtaining the necessary services and support that you will need. I'd like to emphasize that care coordination takes time and planning. When you call the wellness office, our nurses will schedule a time to meet with you. At this meeting, please share as much detail as you can so that we can best understand your unique needs. So, what surgery? When is it? Where is it? Do you know what restrictions you will have after your surgery? What other details can you give us? What is your current plan for after surgery, and do you have a backup plan? Next, more details to the plan. So approximately 15% of patients over the age of 65 are readmitted within 28 days of discharge from surgery. Most hospital readmissions are preventable if best practice discharge preparation and practices are followed. And those are both from peer-reviewed journals. So when you meet with the wellness office, we will give you a sheet, which you can actually find at the back of the room, questions for your surgeon. These are questions that we advise you take with you and ask your surgeon, and things that we will probably ask you when you meet with us. So, talk about the risks of having the surgery versus not having the surgery. Surgery is not the answer for every ailment, but often it is indicated. How should you prepare for your surgery? Often you have to be off of medications like anticoagulants, NSAIDs, before your surgery. Otherwise, they will cancel the surgery that day. When do you need to stop eating or drinking? What other medications might you need to be off of? Some medications you have to be off of for a week before surgery or even longer. Ask your surgeon, how long will you be in the hospital? What are your post-surgery restrictions? Will you be able to lift items? Will you be able to walk? Will you be able to drive? Sometimes you're on pain medicine that restricts you from driving while you're on that pain medication. Sometimes they say you can't lift items heavier than 10 pounds for over a month. So think about your life and how frequently you need to lift items and decide, how will I take care of those items when I can't lift that amount of weight or I can't walk? Ask your surgeon, would you recommend inpatient or outpatient rehabilitation after my surgery? So I'm talking about physical therapy, occupational therapy, speech therapy, and other therapy services. Would they recommend that you go to the health center for a week, or do they recommend that you can go to an outpatient physical therapy, occupational therapy? See what your surgeon says. Let him know about your circumstances and be very detailed so that they can give you the best advice. What extra help will I need after this surgery? What do you anticipate my recovery looking like? Those first couple of days after surgery, I'm sure you can all attest, are difficult. And having care there, if you need it, is necessary. And how long until I feel back to normal? Good questions to ask. So the Wellness Office works with Audrey Spittler, the Campus Social Services Coordinator, in planning some post-surgical care. Maybe you're opting for home health care. You would contact Audrey Spittler as soon as possible and initiate a request for services as soon as possible. Cornwall Manor does not have home health services, but we do work with some home health agencies to coordinate care. The sooner you can request it, the better your chances are of having that available to you. Be sure that they are qualified home health care providers. You don't want just anybody coming into your home when they're not qualified to provide personal care or other services. Ask about how often they can come to your home, for how long, and what type of care can they provide. Some home health providers may not be allowed to give you injections. They may not be able to help you with ambulating or some of those higher level needs. So be sure that the home health that you request matches your needs. And then again, if my home health provider doesn't show up, what is my backup plan? I hate to say it, but we've had situations where the home health agency might have a call off and they don't show up. We take care of it, but what is your backup plan? What will you do if you need help and that provider doesn't show up to your house when they are supposed to? Again, Cornwall Manor offers short-term rehabilitative stays at the health center, which we'll get into further detail on. Wellness Office Services. So the Wellness Office is up here, and we can provide some support for after your surgery. Before your surgery, we can help with your post-surgical care planning. We can assist with prescription refill requests through Hershey Care Pharmacy. You can have your labs drawn up here through WellSpan. We can provide some minor wound care. And by minor, that would be care that isn't going to last for a very long time, and it's simpler wound care that we wouldn't recommend a physician look at. So sometimes we can change your dressing, but we would need you to be able to make it to the Wellness Office. We cannot come into your home to provide that consistent wound care. Primary care physician visits, we coordinate those, and if you see a provider that comes to the Wellness Office, we can set up an appointment for you. The nurses here on campus provide emergency medical response. So we do have our pendant system, and that is for emergent calls. Often our nurses are caring for patients in the office at the time that we receive a call for an emergent response. So we are running as fast as we can to get to you, hoping that if it is a real life or death situation that someone has already called 911, where seconds count, we hope that you would call 911, at the same time you're pushing your pendant. But we really are only responding to those emergency medical responses. I know from time to time someone will fall on the floor. We are happy to help you get back up. We know those things happen. But for post-surgery needs, we're not able to provide that daily check-in where we're running out to check on you in your homes. We're hoping one day we can provide more services in the future as we hire a nurse navigator in the future. I know we've talked about that. And then we would have more support for those types of situations. Our nurses in our office can provide health evaluations. They're licensed practical nurses, so they can do that evaluation and then report those findings to the physician. And again, they can assist you with appointment scheduling. Post-surgery physician visits, essentially the same idea as when you talk to your surgeon, but let the Wellness Office know, when is your post-surgery follow-up visits? Do you have transportation? How often are you going to these appointments? Consider those things. Who will be removing your stitches, your staples, or any drains that you have? Be sure that you make those appointments and let us know if you need any assistance with those things. Be aware that after surgery, they often prescribe antibiotics, and that goes beyond you know, a week or two sometimes, like if you have a follow-up dentist appointment, you might have to take a prophylactic antibiotic. So just ask your physician about antibiotics if that's indicated for the type of surgery that you're having. And then pain medications. Again, on some pain medications, you can't drive for a period of time. What would you do if you feel your pain is not being controlled? Who would you call, and how would you obtain the medications that you need? The front desk. So the front desk, when you're planning for surgery, please notify them that you will be out of your home for whatever period of time you will be out of your home. That way they can hold on to your mail. They can pause the voice friend phone calls if you receive them. And if needed, they can assist you with transportation. Now, speaking of transportation, Cornwall Manor can provide transportation to a surgery, but often surgical centers require a responsible party to stay with the patient during the surgery, which our transporters could not do. After surgery, the Cornwall Manor drivers cannot assist with post-surgical physical needs. They cannot help you transfer into a car. They can't do that physical assistance. And you want someone qualified to be looking over and watching over you in case you would have a health decline. So consider what surgery you're having, and maybe medical transportation is your best bet. So don't drive yourself, please don't. There's first aid and safety, there's an ambulance, or you can coordinate that transportation with a family member or a trusted paid driver. But Cornwall Manor would not be able to take you home from a surgery. What should I pack to the hospital? I'm sure there's other things that you can add to this list, but be sure that you have advanced directives in place or a post so that your caregivers know what you would like to occur if you would go into cardiac arrest or need that intensive care. If you would like that intensive care like CPR, intubation, make those desires known, make sure your medical team knows those things. Bring your emergency contact information. Notify the hospital who your primary care physician is. Bring your medication list, and bring a phone and a charger. Order for life-sustaining treatment. What's the P? Pennsylvania. So typically, your normal, healthy person does not need a post. It's a bright pink piece of paper that some individuals may choose to have so that if they do not want to be resuscitated, that is just bold and out front for emergency medical services to know. So typically, it would be for people that may have a terminal illness or they're at the end of their life and they're like, I do not want CPR. I want to make it known that if you find me lying on the ground, you do not attempt to resuscitate me. So if that's your desire, having a post is in your best interest so that if emergency medical services would find you, you have that pink piece of paper. We often say put it on your fridge or in a well-seen area so that emergency medical services would not initiate CPR. Good question. If you do choose to go to short-term rehabilitation in the health center, again, we recommend a lot of the same things. Be sure to have enough clothes for 1 week. We'll assist you with laundry if you would like that. Be sure you have shoes, CPAP or other medical equipment, hearing aids and glasses, and medications if you are not staying for a Med-A covered stay. And we'll get into that more. All right, so there's your plan. That's what we think would encompass a well-prepared surgery where we feel like we can support you in what your goals are going into surgery. So our little purple pond continues to surgery. Hooray, the day of surgery, it's surgery time. They look very happy. Now, individuals who had a simple outpatient procedure may be well enough to discharge straight to home. Still, We ask that you notify the wellness office when you arrive home. We would like to check in with you and make sure everything is going okay. Hooray, discharge home, please call us. Now, in other circumstances or for more complicated procedures, you may have a longer hospital stay. Once stabilized, hospitals will discharge patients home or to short-term rehabilitation, which can occur in our health center. So you can plan to go to our health center for a short-term rehabilitative stay, or if your physician agrees, you can be discharged home. Again, we're looking forward to you going home as much as you're looking forward to it, and we want to plan for that in a safe, therapeutic way. Please notify us if that's what occurs. We probably would recommend home health services at the least if you do have an extended hospital stay or a complicated surgery. And again, those things need to be planned in advance most of the time to ensure adequate care and coverage. Now, if you make the decision to discharge home, without care, there are some risks and some potential complications. So our poor purple pawn might experience complications. So his recovery is more difficult than he anticipated. And maybe he had injections that he couldn't manage, drains he couldn't manage. Maybe he needs to use a wheelchair. Now, I'm being a little bit vulnerable. That's me in the bottom left corner. I had a cervical disc replaced in my neck about 3 years ago. Came home, it was an outpatient procedure, came home, thought everything would be good, and everything was good. I was laying back in bed. Well, I'll pause. Recovering from anesthesia was very difficult, very nauseating. So I felt very nauseous and I did get sick. But other than that, I was doing good. Laid back in my bed. A couple hours later, I wake up, I'm ready to get out of bed, and I can't get out of bed. I'm trying to sit up, but my neck is very swollen, very sore. I can barely speak. Luckily, I planned for my mom to stay with me for about a day, and she gave me a bell. I rang my bell. I said, "Mom, I can't get out of bed." And I was about 30 years old when this happened, okay? She's like, "Are you serious?" And she had to kind of log roll me out of bed. And from there, I was down on my knees and I could get myself up. But that was something that nobody warned me of. I couldn't anticipate that I would need that type of assistance on that first day to get myself out of bed. So I thought I would be vulnerable and share that experience with you to let you know that you can't always anticipate what your care needs would be, but I would really recommend having someone there that first day, and having home health if indicated if you're having a complicated surgery or planning for that short-term rehabilitation. So our little game pawn might then realize, I need more care, I need to go to the health center, or maybe he already planned to go to the health center. And here we are, and I want to emphasize that our goal as healthcare providers is to restore you to your optimal level of function. That is our goal, and our goal is for you to rehabilitate and get back to where you were before your surgery and go home. And so now I would like to pass the microphone over to our healthcare providers who will talk about our health center and a short-term rehabilitative stay at the health center. So this is Minnie Strickler, and she is our Vice President of Health Services and the Nursing Home Administrator.
Thank you, Jocelyn. Can everyone hear me? Okay, so I don't know how well you can see the photos up there in the slide, but for those of you who have not been to the health center, that first picture on the far, well, your left, that is an actual photo of a health center room. And just as an interesting aside, all of the rooms in our healthcare center are private rooms. So I just wanted to briefly introduce, our session here as we're going to be talking about services in the health center. And I want you to know that the health center is equipped and prepared to support you through long-term stay after surgery or an acute illness. The interdisciplinary team approach is person-centered. In other words, there is no one-size-fits-all. You are all unique, and your care needs are unique, and after a procedure or, an illness, we're going to look at your specific needs and work with you to help you get back to your prior level of function. That is always our goal, and we recognize that that is your goal as well. I do want to talk a little bit about a myth. There are a lot of folks that think if you come to the health center, that's it, you're never leaving. I can assure you, I am here to assure you that the health center is not Hotel California. I promise you. We're going to do everything we can to work with you to get you back to your prior level of function, and you'll have the support services every step of the way, from nursing, therapy, dining services, recreation services. We've got a full team that is going to rally behind you to help you get back on your feet, figuratively and maybe literally. So with that, I am going to turn the mic over to Jennifer Garloff. She is our healthcare admission coordinator, and she can give you an idea what to expect for that admission process and what that looks like. Jennifer?
I'm going to say hi because I think you should always start by saying hello. Thanks for coming out today and learning a little bit about this process. So let me first say that I'm going to reiterate some of the things that Jocelyn said because they're so important in the process. When you know you're going to have a procedure done, reach out to the wellness office, reach out to myself. That's going to go on my calendar and theirs. It's so important to plan ahead. Social services is also a vital asset in that process. So when you know that you're going to have a procedure, there's a couple things that we're going to want to know. We're going to know where you're having that procedure. Are you going to Hershey Med? Are you going to Lancaster General? Are you going to the WellSpan here in Lebanon? All of that's really key for me so that I can communicate with the case management team and plan for a possible admission to the health center if need be. We also want to know when you're having that done, and we want to know what you're having done. So all of those things we want you to communicate to us. My role in the aspect of knowing all of those things is a huge piece of communication. The day of your procedure, I'm going to reach out to whatever hospital that you're having your procedure. I'll be able to get updates. I'll be able to communicate that not only with your physicians through medical records, but also through our team, which helps us when you get to the health center to take better care of you. We're going to find out while you're in the hospital if you need home health instead of coming to the health center. We're going to find out if you need IV antibiotics. Do you need special equipment? When those records come to us, we'll be able to prepare a plan so that we can do everything that we can to get you back out to independent living as soon as we can. One of the things that I want to talk about when you're planning on possibly coming to the health center for, again, a short-term stay, you won't be stuck there, is I need to know who your current physician is. So we have 4 physicians in the health center who have rights to provide services. If your physician is not Dr. Hayes, not Dr. Case, Dr. Yoakum, or Dr. Walden, we want to know that. We want to be able to get your current records, your current diagnoses, your allergies, so we can provide the best care. Please know, though, if none of those physicians are your doctors, I will coordinate with those physicians with your choice. You can decide who you want your provider to be prior to your surgical procedure, so that when you come to the health center, we have someone who's going to write your orders, we have someone who's going to see you and provide you care. Jocelyn went over a lot of things that are important as far as the things that you bring. There are things that can change the things that you bring to the health center. And that I'm sure Denise will touch on, and that has to do with your insurance coverage. So if you come to the health center because you have a need post-surgically, but you have not had, say, a 3-day stay, which will give you that Medicare Part A coverage, you may come to us under a private pay stay, which will allow you to do different things, such as bring in your own medications. So that's why it's so important for us to know up front where you are, what you're having done, so that we can get all of that information and better coordinate for you. I think if I can say one more thing, I want to just touch on the fact that Jocelyn said about the transportation. When you're in the hospital and you're coming to us, we will coordinate that transportation. If you require an ambulance, if you require a wheelchair van to bring you there, we'll plan that with the case management team at the hospitals versus our campus drivers here on campus. And I know that we all have great friends, but put that on someone who's a medical provider versus your friend. Thank you.
Okay, well, hi. My name is Denise Shope, and I am a nursing and assessment coordinator. I work in what they call an MDS coordinator role. MDS stands for Minimum Data Set, and simply put, I do a lot of paperwork. So, speaking of things that have been called before, sometimes people just call me the Medicare lady. So I feel for you, Jocelyn, about that. So on admission, our office helps determine if you have a skillable service that makes you eligible for Medicare A or a managed care insurance coverage for your stay at the health center. And one of the things I also wanted to reinforce was that your information, even though we gather all that information about your health and everything, it is kept confidential and is only shared with the team on what, as each team member needs to know. I know, as being a patient in the past myself, I like to know that. So one of the things we want to clarify, like with Medicare, we also call that like a traditional Medicare coverage. It does require a 3-night stay for you to qualify to have Medicare coverage at the health center. One of the reasons why you don't want to use your own medications is because that's covered under that Medicare stay for us. So that's covered under your Medicare. Managed care insurance, if we know you have a managed care insurance and Jen knows that you might be coming to the health center, she works with the hospital who starts what we call an authorization with your insurance company. So she calls the managed care insurance, hospital calls the managed care insurance. They let them know what you've had done, what your procedure was, what your recovery looks like. So then we get a authorization for your stay at the health center. When we get that authorization, we are assigned an insurance care coordinator for your case. So our office, the MDS office, we communicate with those insurance care coordinators. We send them updates as they tell us we need to, and we tell them how you're doing with therapy. We tell them how you're doing with nursing, and then they let us know how many more days of coverage that they give you. We also communicate with you of when those updates are. You'll see us come into your room and, I'll say, I heard from so-and-so, and this is the next day that we're gonna do another review. As soon as we hear back, we try to get to you as soon as possible and let you know when that review date is. Okay, so one of the things that you might hear at the hospital, people will sometimes come in and say, well, the hospital says I have 100 days of Medicare coverage. But over the years, that criteria has changed a lot. I've been doing this since 1995, and I will tell you that part of this Medicare has changed a lot of their rules. So very few people do exhaust those 100 days, but we do try to get as much coverage for you as possible. The Medicare stay, to clarify that, your Medicare day one starts the day that you enter into the health center. So we consider that your day one as your day of admission. That day one also starts your discharge plan. So right away, we are creating a care plan that's personalized with your needs, with your goals, and with interventions that we're able to share with the nursing team and with therapy of the same goals that you have is what we want on your personal care plan. And shortly after you're admitted, you'll see one of the MDS coordinators come in, and we'll also schedule what's called a care plan meeting. Sometimes I scare people when I come in and say, your care plan meeting is in 2 weeks, and they're like, I'm not gonna be here for 2 weeks. That's okay. If you're not there when that date rolls around, then I suggest, mark that off your calendar. You don't have to come back to the health center for that meeting. If you need a meeting earlier than what we schedule, then we can also arrange that too. The meetings, we also like to invite families as you wish, and people can participate in the meetings on the phone. So we can have, a daughter or a son or sister on the phone, on speaker in the office where they can participate in the meeting. We do some Zoom too. I get a little help with that. Just to let you know, the interdisciplinary team, we meet weekly, and we review your progress and see how, what you're doing with nursing and with therapy to see how you're progressing to meet your goal. We also talk to the direct care staff, the nursing team, so we just encourage you to participate to your fullest ability, not just with therapy, but also with nursing. So we can see that consistent progress that you're making. Okay, I think at this time I'll have Trent.
Good afternoon. Can everybody hear me? Okay, my name is Trent Roadcap. I am the Rehab Program Manager. My office is in the health center, for those that don't know, but I'm often out in the outpatient clinics as well, and we'll get talking about them in a little bit. Right now, my focus is going to be on what to kind of expect with therapies in the health center. When you're admitted to the health center, your doctor generally orders occupational, physical, and or speech therapy, depending on what your needs are, what procedures you might have had done. Like Denise said, if you're under a Part A stay, either Medicare Part A or your Medicare replacement plan, therapies are covered in full like everything else. If you're private pay, we bill therapies under Part B of your insurance or Medicare. And when this happens, before we even initiate therapies, Wendy, our rehab aide, will be in contact with your insurance company to go over what specific services are covered. They'll tell us if there are any copays, if there are out-of-pocket expenses and what the out-of-pocket maximums are, as well as any limitations on visits. Anything like that that's specific to you and your plan, we go over with you so you know ahead of time what to expect on the back end. And as many of you might know from participating in therapy in the past, it takes several months till your therapy bills catch up with what was actually provided to you. So we like to give you that information so you have it on the front end going in. So that is something that we do early on. Generally speaking, if you're admitted during the week, the very next morning, you're going to get an evaluation by PT and OT for sure, possibly speech if it's ordered. If it's a Friday or Saturday admission, of course, they occur on Monday morning. And the therapist will come to your room. They work on getting you up, getting you moving, getting out of bed, and getting going for the day. They'll work with you on what your goals are, what your discharge plan is, and develop a plan of care from there. And really quickly, I'm going to go through the different therapies and what their focus is. Physical therapy focuses primarily on general strengthening, balance, walking, making sure you're using an assistive device appropriately if it's necessary. Occupational therapy is the group that focuses on what we call activities of daily living, things we do every day when we get up and get moving for the day, bathing, dressing, bathroom activities, brushing teeth, shaving. They also work on wheelchair positioning if you're in a wheelchair for an extended period of time, wheelchair mobility if that's needed. And the other thing occupational therapy will do, as we are approaching a discharge date, we work on, or we get an order for and do what we call a home evaluation. And that's where we take you out into your home, and the occupational therapist just kind of runs you through your paces. If there's a favorite chair to sit on, making sure you're okay getting in and out of that, getting in and out of the shower, if you're using the oven or microwave, that you don't have any issues with that. And they may also make recommendations for certain modifications, like maybe a grab bar in the bathroom area to make those transfers easier. When we schedule a home evaluation, that doesn't mean the next day you're going home. Sometimes it does, but we like to schedule those a little earlier in your stay so that we know if there are things to work on, we have time to address them in the health center. And then the final therapy you may or may not receive is speech therapy. And again, that's going to depend on what exactly you're in the health center for. Speech therapy works on speech, obviously. They also work on language and communication, but they also work on cognition if you're noticing there are memory issues. And sometimes after anesthesia, there are some memory issues that follow that for at least a few days. And she works with folks with swallowing issues. So if you notice that things are going down the wrong pipe or you're coughing with meals, our speech therapist can address those issues as well. As others have said, it's an interdisciplinary approach. We are one spoke in the wheel. We don't say when a person can go home. We do say when we feel like somebody is at a level that, it can be considered. And we also are the ones, for better or worse, that either Medicare or insurance looks at primarily for determining continued coverage. So it's important to do your best in therapy and know that we're communicating that activity back to the team and letting them know where things stand with where you are in the process in the health center. And I believe in a little bit, I'll be back up to talk about the outpatient area of therapy, which I know many of you, I look out at your faces and I recognize you. Many of you are participating in those services, but I'll just go over those a little bit later and what their focus is, because it is just a little bit different once you are discharged from the hospital. And before I sit down, I did want to add one thing that could be a question to ask your physician before a procedure, depending on what you're having done. Specifically, if you're having an orthopedic procedure, like a total hip, a total knee. We have quite a few total shoulders lately. Ask them if they recommend what we call prehab or some therapy ahead of time. Whether it's here or elsewhere, oftentimes that makes your post-surgery therapies go much smoother and much quicker. Your rehab process is a lot quicker if you can get some therapy ahead of time and learn the exercises, get some strengthening done, and just get yourself a little more prepared for what you're going to have done.
Okay, I'm back to talk about discharge planning. As was mentioned previously, your discharge planning is really, that begins on day one. We're going to be talking to you as a team about your goals and, your customary routine. Maybe you're somebody who likes to go out and take a 3-mile walk every day. How can we get you back to those things that you enjoy doing? And also, those activities of daily living, those things that are so important to be taken care of on a daily basis. So it begins on day one. The interdisciplinary team will partner with you to set and work toward achieving your goals. I had mentioned earlier that, many folks are there for short-term stays and they do discharge. It's approximately 1/3 of health center admissions that are discharged back out to their prior setting or to their home. And there are a lot of things that, multiple factors that play into that, but I just wanted to share that statistic with you. But we'll work with you to remove the barriers and help you get strengthened and get back to that highest level of function that is achievable. And from our perspective, the overall goal is a safe discharge. You're going to hear that over and over again. We want to plan a safe discharge and make sure that your needs can be met, and that you're not going to be out there struggling just to get things done, Like Jocelyn talked about, something unexpected, like she didn't anticipate that she wouldn't be able to move after her surgery and get out of bed independently. And how are you going to tie your shoes? And what are you going to do about meals? And all of those things are part of the discharge planning process. How are you going to administer your medications? Are you okay with that? Or is there something that has happened that's made that a challenge for you? And, so we will look at it from all angles and work with you to prepare you to be successful after you return home to your prior accommodation. And with that, I'm going to turn it back over to Jocelyn. She's going to talk about what happens after you get back home.
All right, thanks so much. That was excellent information. I do want to emphasize again that information that you share with us here in the wellness office or in the health center, again, is confidential. That is very important to us. Your information will be shared with the minimum amount of people that need to know it, and they will only be told that information if they are involved in your care and they need to know that information. Great. So, our lucky patient discharges home. And hopefully you're discharging home past the complications, but of course there are unexpected complications at times. This is chutes and ladders after all. You need more help than you anticipated. Please let me emphasize, call us for help, the Cornwall Manor staff, not your neighbors. Please let us help you coordinate qualified services for the help that you need. So we might be back to creating a new plan, and that's okay. We hope not, but your surgical site became infected and your surgeon recommends another surgery, back to square one. Some people need another surgery. Now, I will say, typically, if you are spending your rehab at the health center, it's very unlikely your surgical site will become infected. We have great nursing care who will see that that surgical site heals properly and you won't have those complications. We know that not every surgery can be planned for. We know that traumatic things happen, people fall, people get injured, and that we do need to sometimes plan quickly. And we will do that, and we are able to help you. We do that often. So please, even if it's something that you didn't plan for, reach out as soon as something happens, or have a family member reach out, and we will do what we can to help coordinate care for you at any point. So now we will discuss, after you go home, outpatient therapy is something we strongly recommend.
And for those that don't know, the slide up there does have our 2 locations where we have therapy. In the Freeman building down across from the bank is our new space as of a few weeks ago. And also out in the woods at the treehouse, we have a clinic. We do also have the ability to at least start you out in your home. If you're not quite able to get to one of our clinics, we can start the first several visits in your home, get you stronger, more acclimated to back to your home and the distance it takes to get to the clinic, and work with you from there. Just going back and touching on the therapies again a little bit, and how they're maybe a little different from the health center focus. Physical therapy is going to continue with much of the same. General strengthening, balance, walking. Maybe you left the health center with a device you didn't use previously. If we can get you back to a lesser restrictive device or no device, if that's your goal, they'll work with you on that. Pain management. We also do a lot of, obviously, fall prevention, but we can teach some fall recovery techniques if a fall does happen. Some tips and tricks on getting off the floor. Occupational therapy, they'll definitely probably start in your home because that's what their focus is, your success at home. And they can work on some of the basics again, the bathing and grooming, the dressing. They can also work on what we call higher level activities of daily living. Laundry is often an issue. Meal preparation, light household chores. But another area that occupational therapy can focus on is getting back to leisure activities. If there are things that you used to do that you can't anymore or have more difficulty with, they can work with you on those things. And another big area, especially lately, post-COVID, has been what we call adaptive technology. More folks are communicating with their families with devices like iPads, iPhones, laptops. Our occupational therapists can help you with those things. If they're brand new to you or you're having specific issues with them, they can work on those things as well. And the final thing that we have done in the past, occasionally, but it's something to keep in the back of your mind. Some folks have difficulty with things like navigating the grocery store or their favorite department store. And believe it or not, we can help you with that. We can help you with transportation to there. And the occupational therapists in the past have actually gone along and done treatment there, so to speak, just to make that part of your life a little easier as well. And then speech therapy, again, whatever difficulties you might be having with speaking, understanding, swallowing. Sherry, our speech therapist, does come to the home. That's where she does all of her speech therapy treatments. It's a nice, private, quiet environment and allows you to focus on that specific treatment there without distraction and disruptions. Any questions for me on those things? or in general on what I've covered, at least on my portion of therapies. Okay, thank you.
Thanks, Trent. And for those of you who didn't know, this year we purchased the therapy team. So it is a Cornwall Manor therapy now, which is really exciting. And it's really awesome we got to do that. They have a great team. So again, I want to just reemphasize that recovery, this is your goal and it is our goal. That's the winning game piece, the winning game spot. So don't roll the dice on your recovery. Plan ahead to avoid unanticipated complications. Notify the wellness office about your upcoming surgery as soon as possible so we can plan for a successful recovery together.